I'm Gillian. I'm a reader in clinical psychology here in the School of Psychology. I'm course director for the MSc in clinical health psychology. I'm also a researcher specialising in alcohol and other drug use and also behaviour change. I'm really interested in people who are experiencing some problems with alcohol or drugs, but maybe either don't want to do formal treatment or have tried formal treatment and it hasn't really worked. So in practice, this means services like drug consumption rooms. They can also receive connection to health, social and other support. On the alcohol side, it can be things like self-help and also sort of thinking about treatment for people who maybe tried abstinence treatment and it just hasn't worked for them. I'm really interested in supporting people who maybe fall between the gaps of what we traditionally see as treatment and making sure that there are options for them. So it's so broad and it's also really interdisciplinary. So I work with criminologists, I work with public health, medic, pharmacists. So you're quite often the only psychologist in the room, but it makes for really interesting sort of conversations, and bringing in other people allows you to do things beyond your discipline and really try and make a difference to people's lives. So a lot of the work that I do is very policy facing, very impact based, trying to sort of change things for people who are experiencing issues. So I've been quite fortunate to have presented my work to the UK government through the Scottish Affairs Committee, where we were talking about drug consumption rooms. So that's been a really nice way to bring the research of Queen's to Parliament to try and drive change. And that comes from evaluating the first ever service in the UK. So that was led here at Queen's, and it's led to another sanctioned service called the Thistle in Glasgow. I was very fortunate to be invited by the governments of Greece and Portugal to present Queen's work at the United Nations, so at the Commission for Narcotic Drugs, where drug policy globally is made. And we were also talking about the value of bringing in people with living experience to research projects. But domestic policy is also really important, and we are trying to get these kind of services that meet the needs of people who fall between the gap in lots of different ways across the entirety of the UK and Ireland. It's really important because sometimes we are talking life or death here, and the work that we do and the partnerships that we're able to bring together at Queen's does really not just change lives but saves lives. But also when your work is picked up by policy makers, so having your work cited in Parliament or contributing to change, or knowing that the hard work and the going out, and I do a lot of sort of field work on the street and in back alleys to try and find people who are often very, very marginalised, and seeing some of that work that they help me produce, like bring about change in the world, is just what a joy. I think as well with students, it's always lovely to see where they end up and what they've done and what they've taken away from your lectures. It helps you kind of finesse what you do on a day-to-day basis. So one of the moments I think would be when I was appointed president of the Kettle-Brewing Society. So the Kettle-Brewing Society is a research society around alcohol and reducing alcohol-related harm. But it was just such an honour to be nominated and to be able to bring Queen's research to that international stage, and a real sort of testament to not just my own research but all the collaborators that I've had over the years in this particular area.